Good morning, everyone. In the 3 years since Dobbs' decision, 19 states have banned or severely restricted abortion. And as a result of that, women are less safe. In fact, in states that have banned abortion, women were almost twice as likely to die in pregnancy, childbirth, or soon after giving birth. And since that decision, the number of abortions nationwide has actually increased. Because banning abortion doesn't actually change the need for abortion. What we should be focused on is ensuring access to quality reproductive and preventative health care. But this was never about protecting women and children. This has always been about the religious rights views being pushed on all of us and controlling women's bodies. And now, in a post-Dobbs America, the American people have re-elected Donald Trump to be president, a man who is anti-abortion and was found liable for sexual abuse. And so we are experiencing some immediate threats. As you heard, we are experiencing threats with regards to EMTALA. The Trump administration has revoked a Biden administration requirement that would have protected women should they need an emergency abortion because of their health. Now those women in states where abortion has been banned are left to die. We're also facing the immediate threat of Congress's budget bill, which would strip Planned Parenthood from receiving Medicaid coverage. In the state of Connecticut, Planned Parenthood is the largest provider of family planning services through our Medicaid program. And a final threat currently is the Supreme Court, which will be deciding two decisions, possibly this week. One would actually validate being allowed to remove Planned Parenthood from the Medicaid program, and the other would remove preventative services from the Affordable Care Act. And so we have some opportunities here in the state of Connecticut to take action. The first, we just passed a state law that would codify EMTALA here in Connecticut. We need to ensure that our intent is clear and that emergency abortions are protected at every hospital in the state of Connecticut, regardless of their religious affiliation. Number two, if and when this federal government takes Planned Parenthood out of Medicaid, we need to step up as a state and ensure that everyone who needs to receive family planning services can receive them at Planned Parenthood by putting up the money. And finally, we need to be clear that we will continue to be a state that stands up and protects women's health. And so words are not enough. We need to take action. And I look forward to working with everyone here to do that. Thank you.